Our next question to the panel is whether there's any evidence being collected on the long-term damage to health, particularly in children, for patients who have been infected and have recovered. Perhaps that's one for John.
So we are seeing, so we've seen in other coronaviral infections like SARS, long-term chronic fatigue, ME-type symptoms, breathing problems. So it's not surprising that we're seeing this in COVID-19 as well. And they've got various terms, long haulers, long COVID, this sort of stuff that's coming up. And we're starting to set up clinics in the hospital to see these patients, to follow them up. So some of it may be immune related, some systemic effect on the body, some of it may be related to the damage of the lungs, the heart and the blood vessels that these patients have experienced. But it's very clearly happening. And we're seeing it, ME and chronic fatigue tends to have a little bit of a poor reputation amongst the medical profession. Hands up, everybody. We sort of tend to dismiss it a little bit too easily. And I think what we're going to see following COVID is this big epidemic of chronic fatigue, ME-type symptoms, and that will get us to take it a lot more seriously and start exploring why that is. So it's definitely happening. It's happening more frequently than we haven't. And we're seeing. I mean, our first wave is our own staff. They were the ones who became infected first. And the hospital became an amplification centre for the virus. And we're seeing now those patients, actually the ones who've been in hospital have made fairly good recoveries. It's the patients who've been recovering at home who are having these long-term effects. So concerns, but we will be setting up support and clinics to look after.